Hi, my name is Allison Gray. I am a nurse practitioner and I am very excited to be joining the practice at Age Management. I have been practicing as a healthcare professional for about 12 years now, and I'm really excited to be joining a practice that focuses on the whole person and looks at each person as an individual and treats them accordingly. So I started in healthcare as a labor and delivery nurse, and I did labor and delivery nursing for 10 years, and I loved it. And then I felt like it was time to move into a practice where I could affect people's lives more long-term and ongoing. And so I decided to become a nurse practitioner. And I have had the pleasure of working in women's health for the past few years since I have graduated from my program of study. And I've loved every minute of it. It is my passion. It's what I love doing. I worked in a practice that was based on a functional medicine model. And functional medicine is really using pieces of the puzzle to put it together as a whole. Whereas sometimes in Western medicine, we just focus on one piece of the puzzle and we miss all those other things that are going on that are actually interconnected. And so I am really excited to be able to use the skills that I've learned to look at each person as a whole and help them with areas that they might not even realize are related to imbalances that are going on. So here at Age Management, I am going to be expanding on the already amazing hormone replacement therapy program that Dr. Beatix has been offering to people for a long time. I am expanding the women's health end of things. I'm really excited to continue on with the work of replacing hormones in menopause and perimenopausal stages with bioidentical hormones, and in addition to that, adding on services for women of all ages who might be experiencing cycle irregularities, energy loss, change in libido. And so at each stage of life, women experience different imbalances for different reasons. And it's important that we look at what are the outside factors and also where are you in your stage of womanhood and what do you need to be supported in that area. So you don't have to go through menopause and be miserable, and you don't have to go through the time leading up to menopause and be miserable. We're here to help you, and we have lots and lots of great tools to do that. So some things we're working on here that are really exciting that we're going to be offering soon are a weight management and weight loss program. And that program is tailored to fit each person as an individual. There are different pathways that are available to assist you in your personal goals and your personal experiences. And each of those programs is very different from one another so that you can find the best fit based on what is already going on in your life and what you want to achieve, and we're here to help you with that. And additionally, something that I bring to the practice that I'm really excited to work with people on is functional medicine approach to wellness. And what that means is when people have symptoms and they're told by their provider that everything looks fine on paper, or they don't fall into a place yet of needing medicine to treat a symptom, they're left to be still feeling miserable. And what functional medicine does, it looks deeper at that picture, and it looks at what's out of balance and what can we do to help you where you are right now to feel better. You don't have to feel bad even if your numbers aren't bad enough to give you a medicine for.